Welcome back. It is Tuesday morning, and pretty soon we'll be able to track the economic recovery efforts over the internet. But did you know that this site is going to cost taxpayers $18 million? Just one of the things we were talking about this morning with Congressman Bilbray from Washington, D.C., joining us on the phone this morning. Congressman, good morning.
Good morning, Dan.
Good to talk to you. Let's start with what is happening today with the health care thing, because I think that's the kind of the biggest deal. We'll get to a couple of other things in a minute, but we understand the Democrats on the other side of the aisle in your House are going to be unveiling their plan for health care reform today. A couple things. What do you think of the plan, number one? Number two, is it really possible to get something like this done in the time frame that they've given?
Dan, like everything else, nothing's being shown. In fact, I would expect what's being displayed today will not look like anything that will be voted on eventually. So, again, the biggest problem is how do you add, trillions of dollars more debt onto the taxpayers' back, and how you pay for it's always going to be the problem. I think that even the most, the most liberal Democrat understands the burden of that, and just to say we're going to continue to tax the rich sounds good, but in reality, I think the more reasonable centrists understand that any new commitments and entitlements that Washington is going to promise to people is going to have to be paid for by the people.
Yeah, it's a little too simplistic just to simply say we're going to tax the rich. In terms of savings, though, I mean, Congressman, I know that you've been around there for a while and seen these efforts before. Healthcare has taken a huge dive before because it's so complicated, because it is so expensive. But the president has said this time he's going to get it done no matter what, and yesterday kind of playing some hardball on that. But he also has brought together some of the factions that have been fighting over the years, and some of the hospitals and some of the insurance companies have actually offered to give in a little bit, saving hundreds and hundreds of billions of dollars. Do you see that?
Well, I see, yeah, a lot of people are, except I don't see the trial lawyers being willing to say, look, we're just going to have to get the lawyers out of the operating room. One expense that does not provide health care, but it's a huge expense, is tort liability. That
right.
Just got to have a more cost-effective way of doing quality control for health care than having the lawyers and judges argue for years at a time at cost of billions of dollars. And the fact is that if they're really serious about reducing costs, first of all, let's just say flat out, we're going to replace the litigation model with a mitigation model. We're going to do arbitration. We're going to do negotiation. We're not going to go through this litigation, which all that process does is employ all the lawyers that we're throwing out of law schools right now.
Yeah, well, yeah, you're right. So frivolous lawsuits obviously are driving up the cost, and some people are in favor of cracking down on that, and some folks are not.
Well, Dan, one of the things, the biggest thing is not just the lawsuit, but you ask any physician, any hospital, there are, thousands of procedures that are performed every day in this country that is for no other reason than to protect themselves from liability. It's not for the benefit of the health care provided to the patient. It's for protection against litigation. So I think that when we talk about this issue, we've got to talk about procedures that are being done for legal reasons, not medical reasons. And the first thing we've got to do, if we're really serious about this, if we're sincere and not just playing games, we've got to say we've got to replace this system with a new, much more cost-effective system that takes litigation off the table and puts quality control on the table.
Well, that would save a lot of money. Before you leave, just get your impressions. I know you're in the House, not in the Senate, so you don't really have a dog in the hunt. But what do you think about this whole Sotomayor issue?
Well, I think it's kind of exciting to watch. I think that, they did all their posturings yesterday, but today's going to be the fireworks are going to go off. I mean, this is where people are able to say straight off what they think, ask the hard questions. She'll be able to respond in her kind, and I think that this is what the process is about. But again, I'm a spectator. This a lot of people forget about separation of powers, and one of the things is a House member has no more say over this and constitutional questions than any voter in San Diego. So we're all going to be spectators today. We're going to be watching as much as possible while we're in session. But I think that this is the process. We'll see what's going on. I guess it teaches us all, be careful about our spiffy little speeches we give, because everybody is listening now and everything's recorded.
Yeah, watch out when the cameras are rolling.
Oh, I know, Dan, no one's worse than myself, so I just got to say that I'm sure there's 1,000 things that people can take cheap shots, but I guess those who've never done anything never have made mistakes.
Well, you got a point there. You do. Congressman, always good to talk to you.